Thank you all so much for joining us for the 2025 Point in Time Count Data Release webinar. My name is Eliza Wilson. I'm the chair of the Homeless Leadership Coalition Board, and I'll let Molly introduce herself.
Hi there. Good afternoon, everybody. We've officially ticked past that mark. Molly Heiss, Deputy Executive Director for Neighborimpact. Neighborimpact serves as the Homeless Management Information Systems Lead for the Oregon 503 Central Oregon Continuum of Care. So I am the keeper and analyzer of data and co-presenting with Eliza.
During this webinar, we will be presenting the 2025 Point in Time Count data. If you have any unanswered questions, you can follow up today's webinar by emailing us at info@cohomeless.org. For the purpose of time and trying to get through the data, we will not be taking questions during the webinar. However, the webinar will be recorded and the slides, as well as the webinar, will be posted on the HLC website at cohomeless.org. You can go to the next slide. The point in time count, also known as PIT, is a HUD-mandated national survey of folks experiencing homelessness on a single night in January across the country. This data is really the purpose of doing the point in time count is to help us communicate what's really going on at the local level. We collect data regarding the number of people experiencing homelessness, their demographics, potential causes, and how individuals are or are not accessing local resources. The point in time count is organized and conducted by us, the Homeless Leadership Coalition, and collected by our partners and community agencies. HUD only mandates a full count every other year, but the Homeless Leadership Coalition here in Central Oregon has chosen to conduct a full count annually. The full count includes surveying folks who are staying in shelter across the region, as well as folks who are unsheltered. Go to the next slide. Everyone does the point in time count a little bit differently across the country, as noted in the previous slide, that here in Central Oregon, we really try to get an accurate picture every year, and so that's why we do the full count yearly. This year, surveys were conducted between the dates of January 28th till February 3rd. And we had to pick one day that we ask about. And so for the purpose of this count this year, we asked folks where they were staying the night of January 27th. Service provider staff and trained volunteers surveyed individuals in shelters, transitional housing, and at local meal sites, as well as healthcare clinics, motels or hotels, camps on public lands across the region, and canvassed local streets and asked individuals if they could volunteer to participate in the survey. The 2025, 1,252 electronic interview surveys were completed, 190 observational surveys, 666 individuals were staying in shelters on this night across the region, with a total of 2,108 unique unduplicated people who were included in the point in time count for 2025. Surveys were conducted across the Tri-County region, including the communities of Lapine, Sisters, Bend, Redmond, Madras, Prineville, and on the Confederated Tribes of Warm Springs Reservation.
There's also some historical content here that I'd just like to pop in. With the pandemic that affected our point-in-time count starting in January of 21, we realized that a shift in methodology allowed us to do a deeper, more comprehensive count. The reason for that is that previously the populations would avoid or not participate in the interview surveys because they were not interested in interacting with strangers. We used to use a large volunteer force to help us conduct these surveys, and with the COVID pandemic, we were challenged to only do it with providers. What that brought us was a richer participation on behalf of the folks that we were surveying, and offered a deeper dive into our counts across Central Oregon. So since 2021, if you see an increase, some of that is due to a shift in methodology that's based in those trusted relationships. Folks that are providing basic needs to our unhoused population and are there for them and are showing up for them every day are much more trusted than some volunteer that shows up in their camp for the first time. So I just wanted to offer that context. And yes, there has been an increase in unhoused populations in our area, but some of those counts are due to a better, improved data collection process.
Yeah, thank you for that. I think another layer as well to note is that in recent years, we have kind of shifted methodology to include that we have a lead for each different community, and so that they can plan what the count looks like in their specific community, which looks very different in La Pine than it does in Bend, or Bend than it does in Madras. And so having a local service provider that leads, and plans around what the count is going to look like in those different jurisdictions. And why is the point in time count important? Why do we do it and spend so much time? Um, and why do service providers really essentially volunteer their time to do this? We feel it's important to provide this snapshot in time of what's going on in our local community. We definitely need it as service providers to provide context around the folks that we're serving when we're applying for grants and those types of things. But it really also identifies different needs across Central Oregon geographics. As I noted, different communities have different needs. And really to be able to see what those specific needs are in the varying communities is really important. We know that in order to solve this issue or provide resources to folks, we can't have a one-size-fits-all approach. The point in time count really provides information about folks who are experiencing homelessness and allows us to revisit services and evaluate if these services are being used, are they still needed, and if we should continue to fund those resources. It helps us to make a qualified assumption regarding the occurrence of homelessness in Central Oregon. It also helps us to dispel myths as well. Oftentimes, this, people make assumptions about folks who are experiencing homelessness, and it helps us to collect data on the true situation that's occurring locally. It helps us to advocate for additional financial resources at the local, state, and federal levels as well.
And I'm not sure if you all know that our federal and state allocations have a point in time count factor in them. So monies that are coming into Central Oregon are directly impacted by the numbers that we collect, which is one of the reasons that the Homeless Leadership Coalition has opted to do a full count annually, is so that we have a good, solid understanding of what the unhoused population looks like in our region, so we can include those in the formulaic funding.
The definition of who is considered homeless really comes from the federal level definitions, and the Department of Education has a different definition than HUD does, as well as population definitions differ as well. And so that's something that we've worked on as advocates at the federal level to try to streamline those definitions to make it easier for us to do this. But for the purpose of the point in time count, we more narrowly define and count folks who are either living in shelter, whether that's emergency shelter, transitional housing shelters, motel or hotel paid for by an agency, or folks who are living unsheltered. So that's in areas that are not meant for human habitation, such as abandoned buildings, outside in tents, cars, etc. I did want to kind of highlight that some of the definitions that HUD considers to be precariously housed or at risk of housing The McKinney-Vento definition, so with the Department of Education and those programs, they consider those folks to be homeless, but that includes people who are couch surfing, so don't have a lease of their own, are doubled up with friends or family, or people living in a hotel paid for with their own money. We know that folks who are precariously housed do experience greater rates of homelessness. And as I already said, that definition, many of those folks are considered homeless and other kind of funding sources. Not for this, but I did want to highlight that those groups because we know that youth and families, as well as, families, children, and then unaccompanied youth are oftentimes considered at risk of homelessness because they are in these precariously housed situations. Go to the next slide.
All right, moving into the data. This is a capture of the household types that are surveyed for the point-in-time data collection. It's not surprising that we see a large number of single adults consuming the population surveys. Oftentimes we find that people without support systems in family or in friends are often impacted more significantly by unhoused circumstances. The families at 20%, that's a pretty alarming population percentage. We know that we have working poor families that have been impacted by economic factors, and we see that reflected here in the 20%. Additionally, youth is adults. They're captured from 12 to 18. No, the children only is captured from 12 to 18, and unaccompanied youth is 18 to 24 as defined by HUD. So some of those single adults could be captured in the youth percentage. Next slide. So here we show the populations for sheltered and the populations for unsheltered by county. Per capita population, it's not surprising that we see the largest amount of unhoused neighbors in Deschutes County just based on population size. We did see an increase in counts in Crook County, and a part of that is due to investment in street outreach services. They've actually done the most accurate count in Crook County this last year than has ever been conducted. So we see that Jefferson County and Confederated Tribes of Warm Springs have a pretty solid number. Our sheltered population in Deschutes County reflects the creation of those beds, the shelter beds, that were invested in by the governor's orders. And then the unsheltered count is not surprising. We've got a lot of folks that are living out in the camps. We know that the populations are sometimes not able to operate in a sheltered system. Next slide, please. So this is comparisons between sheltered and unsheltered populations between years. Here we see an increased count again in Crook County. That's due to the sheltered or the street outreach funding that came through the governor's orders. They did outreach into Juniper Canyon and really captured a large population that is outside Prineville proper. They're doing a really great job in offering basic needs services as a result of that funding. Jefferson County, we've seen a little bit of a decrease in the unsheltered population, and part of that is due to the Madras shelter that opened in partnership with the Jefferson County Faith-Based Network. And then we see a slight increase in sheltered populations. That was more creation of shelter beds through the executive order money. And then we see a slight increase in our unsheltered populations in Deschutes County. And some of that, again, is due to increased engagement based on camp closures that were imminent and likely is reflective not necessarily of a growth in unhoused populations, but a better, more accurate surveying of those folks based on those engagements. Next slide, please. And these are comparisons based on city. It's looking at the same populations or the same sheltered and unsheltered populations as last year. In Warm Springs, we see a decrease in the populations. Part of that is because they have had an increased investment by Oregon Housing Community Services, have some permanent supportive housing options, some other housing options available to their tribal members. We see an increase in sisters, and that is in part due to the street outreach efforts of the Sisters Cold Weather Shelter Network. They haven't been able to find a spot to open a warming shelter, and so they've done a really great job with their street outreach and engagement with their populations and the care and keeping of those during the winter months. And they also have incredible partnerships with the Forest Service and Bureau of Land Management in terms of point-in-time count surveying participation. Redmond also has a much increased street outreach program. They have a homeless outreach coordinator who is very invested in the care and keeping of that population. They're also looking at some camp movals, not removals, but moving around. And so the engagement with that population has been at a much higher rate. Prineville, as mentioned, the increased funding to have a trusted service provider be able to interact with those folks on a regular basis has resulted in more trust and foundational relationship building, which increased their actual surveys. In comparison of the raw data in Prineville, there were a lot of observational tallies that were done last year, and a decrease in those observational tallies because of the engagement. So people were actually participating in the survey this year. In Madras, there's an increase, but there's also a much more invested team in the Jefferson County Faith-Based and the Madras Shelter. They're leaning into services for their populations and have done a better job in creating connection through their shelter and navigation center. In Lapine, we see a little bit of a decrease, and some of that was as a result of transitions that resulted from the Darlene 3 fire last year. They've done a great job in working to find diversional solutions for some of those households, which means connecting with family or friends and finding some housing options. So I know that they have talked intentionally about meeting their households where they're at and being able to transition them into an option that worked for them. Culver, we had a count of a couple people there as we did in Pal Butte. And then we get to Bend, and if we all look at that number and think about what we've seen visually, it's not a huge increase. We have done such a great job in terms of the service providers, shelter providers, all the street outreach providers that are engaged in helping households transition, whether that be to the new Cleveland Commons Permanent Supportive Housing Unit or to the Old Mill Apartments, or into one of the shelter beds created by the executive order, or just housing readiness and a different plan based on some of the camp closures or the tightening of camping areas. People are more engaged. So that increase is not, it's not that there's 300 more folks. It's I think that people are more engaged. Next slide, please. So this is a comparison of age, the top slide, and it's looking at youth, 268 people under the age of 25. So those are the youth between 18 and 24, as defined by HUD. It also includes unaccompanied youth and youth within families. And then we're looking on the other end of the spectrum, we're looking at the sheltered and unsheltered folks, and 293 of those people were over the age of 55. And we have a growing kind of emerging need for services to older adults who are experiencing unhoused circumstances. We're going to see some populations that are kind of aging into chronic homelessness, and chronic homeless definition is very specific coming from HUD. I believe that's addressed further down in another slide deck. So I'll save that for a moment. If we could transition to the next slide, please. So there's a myth among us that there are such great service providers and a breadth of services in Central Oregon that we get people migrating here for to be homeless in our region. That's something that I know that a lot of the elected officials hear from their constituents. Why are we providing such good services when what that does is that draws a homeless population to our area? This is a question that we've integrated as the Homeless Leadership Coalition, I believe, in the last probably 7 or 8 years, because this question kept coming up with the data. So when you look at the fact that almost 60% of people experiencing homelessness across Central Oregon have lived here for more than 10 years, that's not necessarily a draw to the region. You can see that between 3 and 5 years, 12%. So the majority of the populations have been here for 3 years or longer. And I think that's really important to note that there are a lot of working poor that have been priced out of the housing market and are surviving in an unhoused situation or a sheltered situation because they can't afford economically, they can't afford to be housed in our area. Next slide, please. So
Yeah,
this,
and oh,
go
go
ahead,
ahead.
Liza. Nope.
No, it's okay. And this is, as the previous slide, this is breaking it down by city. And so just showing that the same is true as the previous slide, that the majority of people who are experiencing homelessness here have been here for 10 years or longer. That is the same breaking down by each city. As you can see, it's that these individuals, many of them have been here for a long period of time. If you wanted to add anything to that, Molly.
No, just again reiterating the fact that the people, our neighbors experiencing homeless situations, we can call Central Oregonians, truly.
Next slide. So, and then of those individuals, 80% of folks experiencing homelessness have experienced homelessness for a year or longer. Um, as Molly had highlighted previously, the aging population that are aging into chronic homelessness. This is a significant issue for every demographic that we're working with. When looking at folks who are 55 plus, we know that there's greater likelihood for them to experience some sort of disability or health concern, which is why locally we have chosen to some of our programs in the region, including one that Neighborimpact runs, prioritizes people with medical vulnerabilities because we are serving individuals who are aging in need of, all sorts of, care, including end of life care. And that is happening just as it is happening in our region, of people experiencing housing. It's also folks who are experiencing homelessness as well. This is important to note, just looking at resources and what resources we should prioritize in our region and how we should prioritize funding. Because if folks are experiencing homelessness a long period of time, that shows us that we do not have the number of resources that we need for people to move on from homelessness, so into housing. And we know this is, folks who work in this field know that there are not many housing options for folks who are experiencing homelessness. And when they do become available, we quickly fill them because, the folks that we work with want to move into housing. I'm going to pause in case Molly's the data expert, not me. So in case she wants to add anything else, you
No,
can.
the likely, as Eliza mentioned, so the likelihood of this dark blue 53% of the pie graph growing it is pretty high. We see the 12% population that's between 2 and 3 years. And so HUD's definition of chronic homelessness is that folks have experienced either a continuous 12 months or more of homelessness or 4 different instances of unhoused situations within a 3-year period. So we may see that 12% in the 2 to 3 year space kind of transition into that 3 years or more. So they're transitioning into that chronic homelessness status according to HUD. And as a reminder, this is a HUD mandated activity. And so our primary function as the continuum of care is to answer the questions that HUD asks. And so we may see people transition into that chronic homeless status, understanding that most people that have experienced homelessness for 2 to 3 to 4 and beyond years really are in that chronic homeless realm, in that they continue to kind of decompensate in life skills, sometimes mental health and substance use concerns escalate because they're going untreated and maybe underconnected to services. So we may see that grow in there, but we're on the other end of that spectrum. The continuum has continued to invest in permanent supportive housing options, which is a more intensive case management wraparound services alongside a housing option. We've got the first ever bricks and mortar permanent supportive housing site in Oregon or in Central Oregon with Cleveland Commons, which is 100% full. That's 33 units of people who may have been included in this count this year because those slots opened in February, but they won't be included this next year. They're getting the care and keeping and treatment that they need. They've got a safe place to be. So it just identifies the fact that really the continuum is on the right track with investments in permanent supportive housing. It also identifies that the state of Oregon Housing Community Services is on the right track with their investment in the first ever bricks and mortar here in Central Oregon. Next slide, please.
Oh, sorry. I was just going to say, I think that's a good point in that why we've prioritized prioritized funding for permanent supportive housing type resources is because of just seeing this data of the last couple of years, and that the length of time people are experiencing homelessness and the folks going into chronicity, that's so important to focus on those areas. And I think also it brings back to like the types of programs like the ones that Mosaic are offering to people who are unhoused, and the host team of like bringing people's medical care and resources to them, because we want to continue to try to support those folks and not aging into chronicity. Yeah, next slide. Yep. So this is again talking about chronic homelessness. So of the individuals that were counted for the 2025 point time count, 21% of those folks are experiencing chronic homelessness. And oh, go back. And that is up. I think it's honestly a good thing to see that there is a rise in folks who are sheltered from 2024 because we know that folks who have experienced homelessness, who are, have chronic homelessness definition, it is harder for them to be sheltered in shelter. And so that shows incredible dedication by our shelter providers, the increase in funding for shelter across the region. And so I think that that is a good sign. Folks are accessing shelter when it is available to them. Um, and, the numbers in folks who are unsheltered remain steady. This is a trend that we have seen, the high rates of folks experiencing chronic homelessness in our region, which why, as we said in previous slides, we've prioritized funding for permanent supportive housing and those types of resources. Next slide. So of those who responded to the survey, 54% reported to having a mental health disorder. Some folks, preferred not to answer. It is a private question. 2% said they didn't know, and then 41% said no. I was discussing this with someone from the media last week, just about was I surprised by this? And I would say no. As far as like myths go, it's a pretty common misconception that everyone who experiences homelessness, is struggling with mental health disorder, or substance use disorder. But we know that long periods of experiencing homelessness, is traumatic for folks and likely at times a cause of them experiencing a mental health crisis, right? Or it compounds mental health crisis when you're experiencing homelessness and don't have basic needs met. And so I think it's an important thing to look at and to know that just as I said to the media, there's many of us who are housed that experience mental health disorders, and just making sure that we're, providing resources to folks, whether they're housed or unhoused.
I think another key point here that's reflected on this slide and the next slide as well is that these are voluntary surveys and people are able to answer the way that they see fit. And sometimes that means for this population that they're feeling okay that day. And so they maybe don't want to identify with a label or something that's, kind of seen by them as a deficiency. So I think it's important to note that the respondents may or may not answer. I know that there have been challenges in the past saying, that 80 to 90% of our unhoused population is suffering from a mental health disorder. And while that might be true, how they answer is how they answer. So I think it's really important to note that these data that Eliza and I are sharing with you today are the data distilled down from all of those surveys. Whether or not the disclosure of mental health disorder is accurate, it's accurate based on the responses that we received. And so that's, that can be one of the challenges with the point in time data is that these are all voluntary surveys, or they're an observational tally, which means that we don't get the answers to some of these questions. So I think it's just important to note. And if your brain is swirling right now and you're saying, yeah, but this doesn't align with what I've seen or what I know or what I've heard before, this is the data that we have in front of us today. So important note there, so just wanted to add that. Next slide, please. So this is a little bit of a confusing slide. We tried to figure out how to present it differently and just couldn't come up with a good strategy here. So of those 54% that reported yes, we have 8% of those folks that have identified having a disabling mental illness. So that's what they feel that is impacting their success in life, their ability to operate in an executive function space, to be able to move forward with some of the activities that we all kind of as mainstream population sometimes just assume, why can't that person do X, Y, or Z? Well, when you look at the fact that being unhoused really creates a dysfunction in terms of being able to do normal things, that like submit an application or do paperwork or any of those things. When we look at that, and then we add a compounding mental illness that people are saying is disabling, and then we have that question from the outside population that says, why can't they just do X, Y, or Z? This is why. This is the cost of homelessness from a perspective of transportation, being able to have clean clothes, being able to do personal care things like get a haircut, all of the things that we would need to do in preparation for a job interview or potentially going in to have a meeting with a housing provider. Those things are all exponentially compounded by simply being unhoused, much less having a disabling mental illness. Of those 54%, 8% of people also identified having a disabling substance use disorder. And that could be the same 8%. That could be a totally different 8%. We also get the comment from the larger community sometimes that people that are unhoused are just drug seekers and criminals. And I think that folks that are out there in unhoused circumstances are quite oftentimes dealing with untreated mental health issues, and they're self-medicating. They're not necessarily out there just doing whatever they please. So I think that this slide kind of illustrates that there are folks out there that are pretty incapacitated. And I think but for the great work of our street outreach providers, they would be at a greater deficit and maybe not here anymore. So just wanted to highlight that it is 8% of those 54% identify a mental health disorder or disability, and that these are specific to mental illness or substance use. Next slide, please. So this slide really is reflective of the change in methodology that the region has undergone. And that, again, as I commented on earlier, that's based in having trusted service providers conduct the count, maybe with some support of some trained volunteers that have been around and engaged this whole time, but not a large pool. I don't know how many of you have been around for a long time, and the point in time count used to be a significant volunteer opportunity. It was an event, and more about the event and less about the collection of the data in a trusted relationship between participant and provider. We see an overall increase in our region at 17%. And some of that is due to the increased investments by the executive order money that came out from the governor's office. There has been a lot more opportunity to invest in street outreach services, in shelter provision, and in some housing opportunities. And the one thing that I will say that just based on some of the investments that we've seen, there are at least 100 folks that may have been in this count that were otherwise housed through some of those investments. We see an increase in adults, which aligns with the previous pie chart. We see a little bit of a decrease in the unaccompanied youth. So that's under 25 as defined by between 18 and 24 as defined by HUD. We see not a lot of change in unaccompanied children under 18. And some of this is because the Continuum received a youth demonstration homeless pilot grant for 2 years. So there's been a lot of activity around engagement with youth. There's a youth advisory board currently in our region nothing about us without us. So I think the strategies of the continuum have really greatly increased around youth services. And I see that that investment is reflected here in these line item changes. It's all children. So the increase in all children is in those families, and we see that reflected back in that pie chart in that 20%. The work of multitudes of agencies, Central Oregon Veterans Outreach, providers that work alongside the VA have put a dent in veterans homelessness. And some of that is investment by Central Oregon Veterans Outreach in housing options for veterans. So we see a little bit of a decrease there, which is a great thing. And it also really reflects the fact that housing of all types and of all to complete that spectrum, that's the way to impact our unhoused population. We see our chronic homelessness increase, but a lot of that is due to the aging in of some of those folks that have been unhoused in our community, and they're aging into that 3-year mark or the 4 years within the 4 instances within those 3 years. It's a really convoluted definition. I didn't make it up. HUD made it up, and I'm happy to provide that in writing if somebody really wants to dig into that. But the likelihood is not that we've had a huge increase. It's that we've got more engagement by service providers. The temporary safe stay area has a multitude of providers, and that's in Bend up in Juniper Ridge, has a multitude of providers that are engaging with population. So I see this as people aging into that chronic homeless definition, and also an increase in investment in engagement of those street outreach service providers. Next
I
slide.
wanted
Oh, go
Sorry,
ahead.
I wanted to say
No.
something else. I just noticed, so like I wanted to kind of identify something else that we have done. Like, I can't really actually say we we have like an amazing service provider locally that works in all the school districts, and it's FAN, or the Family Access Network, and they support with our McKinney-Vento liaisons in the school district. So I think a big part of seeing the children number as well as like is because they support with the point in time count. In years past, they weren't part of counting, and they are dedicated to it every year, as well as us actually having shelter options for families. It used to be that in the region we only had a handful at the Bethlehem Inn, and we've really grown services. And so because families are accessing resources, we now are able to count them. So I think that, those individuals were experiencing homelessness before, we just didn't have the resources or the providers to count them. So I just wanted to put that out there.
So this is just a snapshot. The total number of human beings counted in the point in time count this year was 2,108. Of those, 1,812 of them were over the age of 18. 129 of them were unaccompanied youth, and 93 were veterans. And the reason that we have those outlined the way that we do is because that's significant in how we report these data to HUD. So we see an overarching increase of 17%. Which, while that feels significant, it is, but we've seen regions like Lane County that have gone up 34%, and Multnomah County, I believe, went up 43%, but don't quote me on that because I read that 2 weeks ago. So this is just an overview of those populations that we submit data to in the HUD data exchange, which we are required to do as a continuum. So this is just a snapshot. Next slide, please. And this is the good work of the McKinney-Vento liaisons in each school, and we have those across Central Oregon. And we also have the Family Access Network, which McKinney-Vento liaisons are integrated into, but the Family Access Network is a larger breadth of services. So we're unique in Central Oregon in having that, and it's of such benefit to our families. So one of the things that happens is we get asked about the discrepancy between the point in time count and the McKinney-Vento's homeless student data. And it's important to note on that second column in that we see that doubled up folks in McKinney-Vento world are counted as unhoused, which is the more rational definition, but unfortunately it's not the definition that Housing and Urban Development uses, which is what the continuum is held to. So families that are doubled up are housing unstable. It's not the ideal for their children. Sometimes doubled up is sharing a bedroom with an entire family in that one bedroom or living in a garage. So it's not ideal, but it is considered housed by HUD. So that's for in here for understanding, so that you understand why the discrepancy in the numbers between the point in time count and the McKinney-Vento data. Anything to add there, Eliza?
Yeah, I think it's a really good indicator of kind of what we've been talking about during this webinar the whole time, is that when we have service providers that are working with the population and can offer resources to them, we can better count. And so FAN and the McKinney-Vento liaisons, they provide care to children while they're in school. And so the whole school family, the district-wide, refer clients to these individuals who then count them and provide them resources. And so that's the difference in like our 1 day count, like our count of the 1 day of families for that week that we count, is up top, and then their work throughout the year is down below. So I think it just kind of, again, shows and why, our continuum is working towards to do more like what they're doing in the way that they count individuals experiencing homelessness.
All right, next slide. So these are self-reported reasons for homelessness, and some of these questions are located deep in the body of the survey. We have to ask our HUD mandated questions first, and then some of the other questions that we really have as a community interest in knowing the answers to. No one here is surprised by the economic factors being the highest self-reported reasons for homelessness. I think that is going to be our ongoing factor. That is most significant as we see rent costs continue to stay high and or increase. Domestic violence and substance abuse are pretty significant compared to last year. I think, again, some of that is better engagement on the behalf of service providers with clients. We have engagement with all of those populations because of the increased investment in funds from the governor's executive orders. We see an increase in evictions there, and I think some of those are related to non-compliance, not necessarily non-payment of rent. There are still eviction prevention funds flowing, but what that shows also is that there's a pretty impactful reason for prevention dollars to continue to flow, so that housing in stable households aren't necessarily forced into homelessness for the first time because of their inability to pay rent. So we don't have a definition in there on the eviction line item around whether or not that was simply for non-payment of rent, or if that was for lease violations, or if people sometimes are just using the word eviction or the term eviction for being for their lease not being renewed. Maybe a household, a family member of a landlord needed to come back and live in that unit. So it's hard to know without sideboards on that eviction piece, but we are seeing more and more folks that are fixed income that are going to be priced out of the market, and And so we have to figure out as a community and as a state and as a nation how to help stabilize some of our housing in unstable households so that they don't end up in our homeless response system. Legal, that could be a variety of things. We see sometimes folks may make decisions as a younger person that impact their ability to access housing later. The service providers across the region that I know of work with folks to understand what those look like and if there's opportunities for expungement, or if there's a certain deposit addition that we could do. We're trying really hard as a continuum and as service providers to find creative ways to help people navigate choices that they made a long time ago and help dilute the impact that those have on their access to housing. Next slide, please.
So as far as oftentimes we get asked this question, is this count accurate? How can we use this to know kind of what's going on in our region? And we just kind of acknowledge that the count is flawed in a few ways. We talked about it today. We know definitely that methodology and how we do the count, how it's implemented year to year impacts the numbers. We kind of highlighted that with Crook County and how the increased investment in Crook County for service providers and having street outreach teams that have built rapport and having really solid leads in communities, we get accurate data of who's experiencing homelessness there. And so sometimes when we see a dip in an area, it has to do with the fact that service providers, I know during COVID, for example, we had a service provider network that all got COVID the week of the count, and we had some issues in getting proper numbers then. So just knowing that that is kind of where we see how it varies. But the count, what it does for us, it gives us a snapshot knowing this day that we counted for, we had at least this many people experiencing homelessness. We do know that it would be easier to do the count in the summertime, but that's not what HUD asked us to do. And so we do it when we do it based on federal guidelines. But it does allow us to have a national comparison and to look at trends year to year. It allows us to be able to look at, okay, well, how do we improve this next time? What are some partners that should be at the table? Sheltered counts are very, they're significant in that we know we pull those numbers and those names out of the database that shelter providers put in, every 24 hours throughout the region. And so we know that those numbers are there every day. The unsheltered counts have more limitations, as I already talked about. We providers, and based on them being available to do the count, having the capacity to do the count on top of their regular daily work. We do believe that this year's count is more thorough than years past, and it gets better every single year. However, there are variables that cause the number to fluctuate, as I kind of already discussed. The number of folks who decline to participate in the survey, in previous years, as in this year, we've trained providers that if somebody says no to the survey, you do oh my gosh, what is it called? I'm spacing it. The type of survey they do, where
The
they just, yeah,
observational.
an observational survey. And so that's why you see those surveys in there. That's an individual who declined to participate or wasn't able to participate. And the reports from street outreach workers or school-based advocates as well. Next slide. As when I was talking about the McKinney-Vento liaisons, they use a system where they enter data on a regular basis so that they have a by name list of all the students in the region and across the country that are experiencing homelessness. Our continuum with the support of Neighbor Impact and COIC, have been investing in data quality, in data staff, and in moving us closer to having real-time data. We do have a quality by name list, but we are just a little bit a ways from having it to be as comprehensive where we could use it as the point in time count instead of doing the count. The quality by name list, it would keep a running list of every person experiencing homelessness across the continuum. And it would really rely more on service providers entering data regularly into HMIS, and require us to bring more partners in to join us in entering data into that system. We do think this is meanwhile, we do think this is a meaningful goal to work towards. Do you have anything to add with that, Molly? Because I know that you've been kind of spearheading this over the years.
And no, Lane County has gotten just recently to the place that they can utilize their by name list in lieu of their point in time count. One of the reasons that this is most imperative is because that continued engagement helps build a profile, so to speak, on our folks experiencing an unhoused situation in our region, which helps us to better identify gaps in services or housing types that we may not have been invested in previously that would really be a solid option that folks would be interested in. So it helps us to look at those needs more comprehensively and create systems or programming or investments in the most needed services or what might be the most utilized housing options for these folks. So it's really best practice. We are leaning in and continuing to try to find ways to invest, again, as Eliza mentioned, in staff to be able to get to the data quality that we need to be able to really lean on this as a valuable tool. I mean, it's still valuable. It's just, do we have to reach a certain threshold for HUD in order to utilize that as the point in time count?
And in I think doing this work, we've really worked on how can we be better about having data visibility, and a dashboard that the public can look at. And so I think that as a whole, the community, us investing in this time and energy to do this work, and as we get closer, I think it would benefit all of us in the community. So next slide. We wanted to, put this slide in here because we do, as the continuum, believe that we can, in Central Oregon, get to a functional zero space, where we have, ended homelessness. And what that means when you hear us talk about ending homelessness in the region. Ending homelessness means that if someone does experience a housing crisis or is experiencing homelessness, that our community has the resources and support that the person needs, because everyone's has unique needs and unique abilities, and that we would have those resources to move people back to housing stability. We've seen that communities across the country have done this for the veteran population. And we've gotten really close locally on having the resources that veterans need to move them in to housing, having more housing options for veterans locally and across the country. Many communities in the country have gotten to the functional zero space of ending veterans homelessness in their community because they did have the resources that when people experience housing instability, that either they were able to put them, back into a place where they were stable before they experienced homelessness, or when they did experience homelessness, quickly put them in resources or offer resources that were tailored to fit the needs that they had. Getting to functional zero is just that when a number of individuals experience homelessness, whether sheltered or unsheltered, is not greater than the monthly housing placement rate, so that we are able to house more people than who are going into homelessness locally. I think that we are moving towards, as we kind of discussed in the previous slide, having the ability to kind of evaluate this for as our continuum grows, and our data quality grows, being able to evaluate when how many folks are entering homelessness and then how many people are being placed into housing, so that we can really look to see the flow and whether or not there's more people entering homelessness than who are exiting. Next slide. We are always talking about measuring our impact, and how we're doing as a community in comparison with other communities across the nation, and often, leading on communities who are doing things very well or have new ideas to try those things out, and knowing that we don't all have the answers, and it's a collective impact work. We do evaluate our success and the needs of the community using system performance measures. So that includes how many people are in the system who this is their first time experiencing homelessness, how long people experience homelessness in our region, and the successful placement and retention of housing, as well as when people are put into housing or resources, are they returning to homelessness and at what rates? Um, we also look at, are people increasing their income, because that helps them maintain housing once they are placed in housing. These are all really important things to look at, because they show us, where some gaps in the community and community resources are. While looking at these in previous years, this is what kind of helped us determine what our priorities should be, what our priority populations should be for prioritizing them for housing, and also prioritizing the type of housing that we bring into the community. So this is something that we're always working towards, is improving these for our continuum. Next slide.
And that flows really nicely into the continuum needs and priorities that that we see out of this data, we see from reports from service providers, we see in review of the system performance measures. There are 4 reports due annually to HUD that look at system health and gaps. And so we've listed some combination of all of those here. Additional navigation centers to help increase connection for those unhoused populations to services, whether or not they feel comfortable in utilizing shelter. So navigation centers can help with housing readiness, regardless of folks being in shelter or not. They can help with some diversional connections. So when we say diversion, it means diversion out of the homeless response system. Sometimes that looks like reconnection with families outside or inside the area. That might be an option for folks. We also look at the need to have additional shelter beds or shelter alternatives for all populations. And transitional housing is also a huge necessary step. So when you have, if any of you, I know most of you have, but some of you have not, working with somebody that's experienced a pretty significant period of homelessness, reintegrating into, we'll call it mainstream living for lack of a better term, is oftentimes really hard. It's hard on a social level because folks that are unhoused often have created their own communities, something that we don't necessarily think about when we're doing housing placements. They don't necessarily depending on how long they have been in an unhoused circumstances, they don't necessarily have skills ready to go to be able to do bill pay, to do housekeeping, to do budgeting, to do grocery, like meal planning. And so transitional housing is really a little more independent option than shelter, but it's still got some pretty significant supports that are kind of phased out as folks grow those skills. And so we see that HUD shifted from a transitional housing model to a rapid rehousing model and kind of left a hole in the interim between shelter supports, shelter services. People are ready to not be in shelter, but they're not yet ready for an affordable housing unit on their own. Transitional housing is the puzzle piece that's missing there. Permanent supportive housing units, as we circle back to the chronicity of some of our unhoused populations, that's an imperative support for folks that may not ever be able to be independently housed. Maybe they have a pretty significant co-occurring disorder, mental health, substance use, a medical issue that is chronic and ongoing. Those folks need permanent supportive housing, and that's because that's attached with those wraparound services so that folks have supports. And also the designated units preferred over scattered site comment goes back to that sense of community. So one of the things that we're seeing at Cleveland Commons versus the scattered site-based model is we're seeing that sense of community that people come in from a camp or some sort of creation of community that they've originated themselves. We see that when they're put into a designated unit that has other populations that are also needing permanent supportive housing, there's an opportunity there to create that sense of community versus putting them in scattered site, which sometimes can increase their feelings of isolation and disconnection. And oftentimes we've seen folks leave that on purpose because they desperately need that human connection. We need affordable housing units. Nobody is new to that conversation, but we need to be really conscious about the definition of affordability. Affordable for whom? And a very low income means a subsidy from either the state level or at the federal level. We also need to continue to grow the outreach services so that we have engagement with folks so we can help start to navigate them down a path to what option is going to work for them. That's how we really have impact on our unhoused population, is by right-sizing the solutions to the need of the population. And it's by person, it's by household. Everyone's circumstances that they're experiencing in an unhoused situation is derived from a different, unique set of events that have happened to that household, and the solution is just as varied. Rental assistance is also a huge need for prevention, to keep people from entering the unhoused system for the first time. The other piece that we can't forget about in this solution is the landlords. When we look at the private landlords that are oftentimes willing to take a risk on our population, and I say that because sometimes there are circumstances that happen because somebody was in an unhoused circumstance before they come into rental housing, that they just don't know how to navigate living in a unit and the rights and responsibilities of a tenant. So landlord mitigation is key. Relationship building with landlords is key. That's one of the ways that it is going to be easier for us to help support some of those high acuity clients in getting into a housing opportunity, because we all know that some of our population is not super attractive when there is competition for a unit, just based on some of the decisions that they've made previously in their lifespan. So it's really important to look at landlord mitigation and offer some insurances, whether that's on the front end as a lease buy down or as additional deposits, or whether that's on the back ends for mitigation of damages or making a landlord whole in the event that somebody left without full payment of rent. So that's really an important piece that sometimes we forget to consider is the landlords across our region are incredible partners in this effort. And we need to not leave them out of the conversation, especially in terms of funding. Next slide, please. So I think it's really important, and I'm going to leave space for Eliza to chime in here, that we understand that it goes back to the it takes a village conversation, in that it's not the singular responsibility of the service providers across the region or the county and city entities across the region or any of like we have to come together in these conversations. We have to hear your concerns so we can respond, but we also need to do a better job about storytelling and engagement with the larger community. So I think that bringing folks forward that have that it takes a village mentality and helping to engage them in, in attendance at public meetings to be able to have those one-off conversations between people that are really NIMBY focused and really upset and folks that have experienced a solution that worked. I think that's really important. I think it's important that we stop finger pointing at each other and work together to solve this problem. Advocacy is also important. So if you have a particular area that you have passion about and are willing to connect with the larger service providers or the county and city entities to help work together to come to solutions versus working in silos or working in opposition to each other. Eliza, I know you have thoughts and feelings about this, so I'll hand it to you.
Yeah, I just have to say, like, I know this isn't the slide where we say thank you, but I really think Central Oregon does helping really well, being caring of each other as service providers, being um, open, and that, anyone who wants to help belongs. I mean, if you look at the incredible reach of our faith-based community and how much work they're doing across the region, oftentimes for free, you know, not being paid, how many incredible volunteers we have doing work in the camps, and their, willingness to engage with service providers. And I think that's just kind of the work that we need to continue to do. Service providers are incredibly collaborative in this region. So much so that, in previous years, there was an announcement there was going to be funding to the region, and many of us met and were like, okay, well, we're going to ask this, and then that way everyone had, we really coordinated around like how much we would ask for to continue to do our work, because instead of competing for funds, and just that there really is space for everyone to help and care for our neighbors, and that the more we can show them that we care and that we acknowledge them and we don't ignore them. It can be incredibly isolating for folks to experience homelessness and often be ignored by the public. And so I think that it really takes us all. It takes a village, as Molly said, so well. And I think that something that we can do to kind of further this work and is to ensure that we leave space for people with lived experience and their voice and their leadership in this work. And we want to continue to do that better as a continuum, and make sure that we pay folks to be that, whose job isn't to do this, to kind of be involved in the planning and leadership of this work, because their lived experience is so valuable to knowing how we can serve the population better. And that's all I have to say about that. Yeah. And yeah, we just really thank you for your time, for your care. Um, if you participated in the count, we know what a big undertaking it is, how much work it is. Um, but really just how meaningful it is to make those connections with folks, with all of our neighbors. And just thank you so much for all the work that you've done, if you are doing this work, and for really, being interested in the work that us service providers are doing. As I said previously, we are going to have these slides on the website. We'll have this recording on the website. Additionally, there are some folks who are really interested in making community specific flyers or one pagers with information so that you can quickly find if you live in Bend or Warm Springs or your community data, so that it would be broken down into those slides. So that in the coming week or two, staff will be working on that as well. And we ended a little early, so thank you guys so much.